Hi, I'm Dr. Massey. I want to talk to you guys today about orthodontic treatment, the different types of things that we can correct with braces or Invisalign. So it's usually called a comprehensive orthodontic treatment or a phase 2. So phase 2 is maybe you've had phase 1 before, which we talked about was just to correct some red flag issues, as I like to call them. And now you're ready for your second phase because all of your permanent teeth came in. Some people, not everybody needs phase 1, so some people just, come in and I might say, let's monitor, let's see how you're doing, and finally you get to the point where you have all your permanent teeth and you're ready to actually start your orthodontic treatment. Now there are several options for braces. We have the metal braces, which is kind of the traditional what you've seen with the wires. And then we have clear braces. So these, like from far away and in pictures you can't really see them, but you still have the metal wire that goes across. And then we have Invisalign. And Invisalign is removable. It's a type of a plastic and you switch them out every so often and it straightens your teeth out over time. The nice thing about Invisalign is that you can eat whatever you want. It's really easy to brush and floss. There are no emergencies. However, they are removable. So if you don't wear them, they're not going to work. So the types of things that we can correct in phase 2 or in a comprehensive orthodontic treatment. So like I said, a lot of times it's once your permanent teeth have come in, we go ahead and get started with this treatment. However, there are certain times where you don't want to wait for all of your permanent teeth to come in. For example, if there's a baby tooth that's still there and we're waiting on it and waiting on it, and you're waiting for that one to fall out to come in and see the orthodontist, there might be some kind of issue or reason that's not allowing that baby tooth to fall out. And if you wait too long, the permanent tooth is going in all different directions and it can cause damage to the other teeth next to them. So, the AAO does recommend to get a consultation by the age of 7, and we should catch it at that point if we see anything like that going on. So I'm going to go over with you some of the things that we can correct with orthodontics. So one of them is this overjet, what a lot of people call an overbite. This is actually called an overjet when your top teeth are very far in front of your lower teeth, and that can be either from your lower jaw being too far back, your upper jaw being too far forward, or a combination of both. And this makes it very difficult to bite into foods like Big Macs and pizzas and stuff like that to cut through your food, so that's something that we definitely want to correct. Also, an open bite. With an open bite, it looks like this, and it's just impossible to bite into any foods, obviously, because you can imagine when you try to bite, your front teeth don't touch, so you can't bite into any foods. And then there's an underbite, where your lower jaw is too far forward or your upper jaw is too far back. Again, making it hard to eat, and sometimes this can actually affect your speech too. So that's something that we want to correct. And then a crossbite, where your upper jaw is inside your lower jaw, and it can be unilateral, meaning it's just on one side, or it can be bilateral, which means your whole upper jaw is narrower than your lower jaw. And sometimes that can cause people to bite their cheeks. If you don't have enough of an overjet, buccal overjet, when you go to bite down, you can bite your cheeks, and sometimes I do see that with patients. And then of course there's spacing, so that's when your teeth are separated and food can get caught in between your teeth, which is really bad for your gums if food is constantly getting jammed in between your teeth, and also can lead to higher cavities, higher rates of cavities. And then there's crowding. That's usually the most typical reason people come in, is because they see the teeth are crowding, they're kind of all on top of each other. Sometimes in those cases we need to take teeth out, sometimes we don't. Everybody's case is different. You really just need a consultation with your orthodontist to see what you would need. So another thing is impacted teeth. So that's when your teeth don't have room to come down. Either the other teeth have hogged up all the room and the permanent tooth doesn't have any room to come down, so it starts going in a different direction, or sometimes it can be fused to the bone, up in the bone, and it can't come down. So these are all things that we can correct with orthodontics. The biggest thing though that I see, the biggest difference, and my favorite part, is improving self-esteem. So a lot of times I see patients that come in for a consultation and I ask them to smile so I can see what their smile looks like, and they tell me I don't know how to smile, or I don't smile, or I don't smile in pictures. Or if they do smile or laugh, they quickly cover their mouths because they don't want me to see their teeth, or they're just not used to letting other people see their teeth. And so that is the biggest improvement that I see in people's self-esteem. Afterwards, their teeth are straight, they smile, they're not used to smiling, they have to kind of learn how to smile again. But it does make a huge difference in people's lives in that way too. Sometimes I've also seen where patients come in and they get bullied at school because of how their teeth are, you know, and kids can be so cruel sometimes, and you know, they just feel bad about themselves because other kids pick on them. And sometimes even in adults, I see people who are going to be getting married and they're self-conscious for those wedding photos, and a lot of times they want to come in and get Invisalign to fix their teeth for that as well. And you know, of course, that gives you a confidence boost and you can smile big and look happy in your wedding photos. So definitely self-esteem is a big byproduct of what we do as well. So I'm going to go over some cases with you guys, show you some cases that I've treated, and just show you different examples of things that I've done. Obviously, you know, you can have more complicated, less complicated, all different kinds of cases. These are just some that I have that I'm going to show you today. So you see in this first photo we have an open bite case. The teeth aren't overlapping, and you can see at the end the bite did close down. We used braces and rubber bands for this case to help her close the bite down. And then we have a very opposite situation, which is a deep bite. You can see the overbite is 100%, the top teeth 100% overlap over the bottom teeth. And also she has crowding. So we straightened the teeth up, opened up the bite with the use of some rubber bands also. And you can see the gums are a little bit puffy here. That's why it's really important to make sure you're brushing and flossing. So the next case you can see has a cross bite and an underbite and crowding. Again, we were able to use some appliances like an expander to widen this out and straighten everything up. In the next case we have another cross bite and some more crowding. Impacted canines, we were able to open space to bring those teeth down into place. Next case, some more crowding. You know, she had one of her teeth, it almost looked like she was missing a tooth. It was blocked out behind the other teeth, and we were able to make room for that one and bring it forward. This case, we had to take teeth out. Next case, again, you see the crowding. The two upper teeth are behind the lower front teeth, and we brought those into place. The next couple photos you can see are from a side angle, and this is showing the overjet, and it's showing how we were able to correct the bite. In this case, we used Invisalign, and we were able to just use the rubber bands and the Invisalign without any other appliances to bring the teeth back into place. Here's another one showing when the teeth flare out, how we're able to bring that back and correct that flaring and the overjet. Another case, the next case, another one we did with Invisalign again, to straighten everything out, get them out of that crossbite in the front. And the last case, you can see he had a lot of severe crowding, underbite, crossbite, he had it all. For him, we used an expander and a face mask, and we did have to take some teeth out in order to get everything to fit together properly. So at the end of treatment, everybody gets retainers, and it's very important to wear your retainers, because if you don't, your teeth are going to go back to how they started. You're going to have to get braces again, which, you know, people don't want to do, of course. One time is enough, or Invisalign again. So you want to make sure that you're definitely wearing your retainers at the end of this treatment.